What's up, everybody? Jesse Burdick here for the Power Project, supertraining.tv, powerwad.com. Got a question from Taylor M.W. Taylor M. or W. Thompson, or maybe both. I don't really remember. He's got a question about some hip impingement, specifically hip cam disformity, which is a type of hip acetabulum deformities or hip impingements of the acetabulum. So there's three kinds. The other two don't matter because he didn't ask about them. But hip cam is basically when kind of the ball and socket, the ball is kind of the top of your femur. The socket would be your acetabulum, depending on where the bone is kind of meeting in the socket. What ends up happening is the bone starts to deform, opposed to kind of being a nice ball shape. It starts to kind of resemble kind of an oblong, rectangular shape, very similar to a camshaft in a car. What he's asking is, how do you deal with that? How do we work around it? How do you get to go ahead and squat, deadlift, etc. without an immense amount of pain? What are some options? So obviously the first thing that you're going to have to do is go ahead and really see how bad this deformity is. Get some recommendations from the doctor as far as what you should be doing. Is it going to continue to get worse? Can you get it better? Through muscle work, via just some proper hip range of motion, just some hip drills. Make sure those glutes are turned on. Make sure you have as much range of motion as your hip is going to allow you to have. Is going to be really important. And then what you also got to deal with is just the surrounding musculature that's going to be affected by this condition. So if your hips are kind of mangled or they're not moving really well, what we got to look at is look at your knee, look at your ankle as well. Make sure that there's some stuff that isn't developing down there that's going to cause you some problems in the future. So make sure that you're got proper ankle range of motion, that your calf is opened up. Make sure you're doing knee stuff. Make sure you are rolling your quads. Make sure you're doing your terminal knee extensions. Make sure the inside of that knee is protected. But again, most of all, make sure you have proper range of motion in your hips, as much as you can get out of it. You need to do some mobilization. Again, as always, go to mobilitywad.com. Our buddy Kelly Storette will have a whole list of stuff for you to work on and do. And past that, you threw out the option of having some briefs, squatted onto a higher box. That's great. Any of those things are going to be options, as long as it's going to allow you to keep training, which is what you want to do. If it hurts, probably not a great idea, and continue on and go from there. You got to go ahead and whittle down all the options that you have. Make sure you can go ahead and squat with all the bars, squat with different boxes, squat to foam, squat to a higher box, briefs, whatever's going to help you get out of what you want out of your training. That's going to be something that you got to go ahead and do. But you also got to consider this. What's it worth? It's training. It's not the rest of your life. Or is it the rest of your life? Is training the rest of your life? You decide, make a proper decision, and kind of go from there. But anyways, good luck. Hopefully that helps. Thanks, Taylor.